Third graders, you guys did outstanding, so thank you very much.
Good job. Thank you. Good job, Jack.
Next is Youth Risk Behavior Survey.
Hello. So Roar should go out the door.
Yep.
They did a very good job. So I'm Celeste Clark. I'm with the Raymond Coalition for Youth. I'm the director, and this is Kathy Pouliot. She's our communication coordinator for the coalition as well. And we're here to give you the 2017 Youth Risk Behavior Survey results that we do in the school each year. I want to thank the school board and the superintendent and the principals for letting us conduct the survey. It's an opportunity for us to reach the students. And obviously the data that we collect is hugely important to the work that we do. It actually guides all of the work that we do. And you house the students, so we wouldn't be able to have access to the data without you, so thank you for that. Something I want to stress is that the data is from the students, but the coalition really operates on an ecological model. So the school is just where the students are. This data represents our community and the things that are happening in our community. This is not related to the school, and I just want to stress that. That's very important. A lot of things influence someone's decisions, and this model shows that family, friends, peers, where they go outside of their family, to the school, to church, to different activities that they participate in. So there's a lot of things that factor into that. The coalition's been around since 2000 is actually when we started as a grassroots effort, and we are currently in year 8 of a drug-free communities grant. Part of that grant requires that we work with all of these groups that are on the screen who have to actively be involved in the work that we do. And there's a reason for that, because when we're all working together as a community, we're much more likely to have positive outcomes and success in our work. It's kind of like a connect the dots. The coalition is there, and when we need resources to bring in, the school might have some great resources, the police might have some great resources, healthcare. We can kind of mix them all up and get great results when we're together doing things. So where we started with the Youth Risk Behavior Survey, back in 2007 is the blue column on this chart. Hopefully you all have a copy of it also. Again, when I said that the data drives our work, we use this data and we see where the issues are that are bubbling. That looks like an area that we need to put some work into. So in 2007, that was cigarettes, alcohol, and marijuana. And this results here is for 2015, where e-cigarettes, which is also referred to as vaping now, people might know it, or juuling, popped up, prescription drug abuse, and heroin. Those were big things that we started to target a lot of our work towards, especially the heroin opioid situation, because people in our community were dying and people really needed resources. So that's where we put our effort. And the results were those things came down. E-cigarettes didn't come down much, but it came down a little bit. Prescription drug abuse came down, and heroin drastically came down. 41% of students have reported using a vape product in 2017 results. And this results is for the Raymond High School students, so just at this level here. I do have some middle school also. If anybody has a question as we go along, please let me know.
So, like, for opioids that aren't heroin, like prescription painkillers, that falls under prescription drugs, I'm assuming?
Yes. So how this question is asked, it's taken prescription drug without a doctor's prescription for the purpose of getting high. So it wasn't something that was prescribed to somebody to get well. Or
Okay. Do you think it's possible to create, I mean, this is just something I'm interested in, to see a separate category for prescription opioids?
That's a very good question, because that has come up because of prescriptions that are prescribed for anxiety and mood disorders and things like that. I can look into that and I can get that information. I'm not sure, I don't know if it's in the report that we've already taken. I just compared data that we had from previous years, so that's a comparison data.
Thank you.
I will look into that. And I also want to say, Dr. McCoy did ask for the results for the state of New Hampshire, so I could show you where we are with the state of New Hampshire. That data is still not back yet. So in the interest of making sure this data got to you, we put this presentation together. So I went for trend data to show where we started back in 2007 and where we are in 2017. And this is past 30-day alcohol use. You can see that it took a significant jump in 2017. I'm going to explain a little bit more about that. That's obviously something that's on our radar. If you look at 2015, again, if we go back to, we focused heavily on opioids, prescription drugs, and heroin because we really needed to focus on that. Not that we didn't focus on alcohol and marijuana, but we didn't focus as much on that. In past 30-day marijuana use took a big jump also, something that also wasn't surprising, and I want to just clarify and emphasize this is not something that was surprising to us, and when we look at other towns of the state of New Hampshire, I'm very confident that this is going to happen in other places too, because if you think about the news, when we look in the news, decriminalization, therapeutic cannabis, is it legal, is it not legal? It is illegal to use marijuana in the state of New Hampshire. But those are very confusing messages for adults and for young people to get those messages. So this was not overly surprising to us. And when we compare the two, alcohol and marijuana, you can see where the rates were going down. And again, in 2015, they went up together. If young people are going to experiment with risky behaviors, they typically do both of them together. So if you can see, they kind of parallel each other. And it just emphasizes the amount of work that we need to do addressing underage drinking and marijuana use. Something that was very concerning is at the bottom statistic that I threw in there. 11% of students report driving in a car with somebody who has used alcohol. Yes.
Is that only peers, or is that any person?
Any person. Yes.
Is that just anybody in the car had used alcohol, or is it specifically the driver?
The driver.
Okay.
So.
That's, yeah, very concerning.
Yes, very concerning, especially for alcohol. But then if you look at the bottom statistic, 28% of students have driven in a car with somebody who's used marijuana. And again, that goes to the confusion around marijuana. Somebody who uses marijuana is just as impaired as somebody who's used alcohol. It affects all of their driving responses, how they behave. So it's not safe to use marijuana and drive a vehicle. And that's a message that we obviously have to start getting out there more. There's a lot of misunderstandings around marijuana, and we've been talking about how we can work together in the community and with the students. The students have identified this as well as something to work on. So I threw in some middle school data, which this is all pretty good data, I think. Obviously, we do a work, the health teacher does an amazing job down at the middle school. She works very closely with us, and she implements a lot of programs. If you talk to the students, they'll tell you how great they think she is also. She's teaching them about these things. So our rates of alcohol, marijuana have all gone down. Prescription drugs, that column is a little misleading. It's only gone up by 1%. Still concerning, but something to be aware of. The e-cigarettes and vaping, that's our biggest concern. That's come up over and over again. I was just talking about it with Mr. Woodward. It's been in the news. I don't know if you've seen the newspaper articles. It's something that the kids have brought to our attention. I don't know if you have a comment on that. The juuling is the newest thing.
Yeah, you can smell it in the bathrooms. It's pretty bad.
Yeah, and it's very, it's easy to hide. It looks like a USB drive. You can, when you're blowing it out, you can blow it in your shirt, so it's very discreet. Teachers may not even know it's happening in school. So something that we're going to be pumping a lot more information out about as we get it. So again, when we look at marijuana use, what is a contributing factor if somebody thinks it's wrong? Typically, if somebody knows something's wrong, they're not going to hopefully do it. So perception of wrongness is important, and you can see that's gone down for our students. Only 23% of students report thinking that it's wrong to smoke marijuana or to use marijuana. And that's the messaging that's out there. So we just need to do a little bit better of a job counteracting that message and providing accurate information. And even at the middle school, the perception of wrongness has gone down there as well. Not surprising. Again, it's all over the place.
Do you think it's possible to do a grade breakdown based on what percentage of the grade thinks it's wrong?
Yeah, we actually can do that. I do have that. I don't have it with me, but I have it in my office.
That's okay. Thank you.
Yeah. I love your questions. How does marijuana impact the school? It's very important to point out that academic performance is directly correlated to marijuana use. It negatively affects learning, and is linked to a higher dropout rate. So that's why it's very concerning to us to know this information and to be proactively working on this when we identify an area. And it's been known, been associated with lower test scores, bringing down math, reading, and writing standards for every 5% increase. And our increase went up 12%. So that's something that, from a school point of view, it would be very important also to make sure that we're getting this information out into the community. We have lots of resources on our website, and these different websites where this information comes from has a ton of information on it. So we know in prevention that if we want to decrease use, we have to decrease access to these substances and increase awareness. That's what the coalition is about, providing information like this and going out into the community and making sure other people are aware of this information, and then limiting access. So these are the students who report that it's easy or very easy to access. I have alcohol, marijuana. They've gone down a little bit. Prescription drugs, access has gone down, heroin's gone down. And then, so those are all good things, that the rates are going down at least. And then the vaping, which has popped up, it's easy to access that, yes.
So, since it's a relatively new phenomenon, is it accurate to say that in 2007 it wasn't even on the radar? Because I don't see anything there, I just see a
This
bar
question
for-
is brand new, exactly. Okay. So this is something
no
that's come up.
comparison for it at this point.
So in 2015, we became aware of it, so that's how we were able to start tracking it. And how easy is it for someone to get this was a new question that was just added this year. I can tell you I was sitting in a room with a bunch of high schoolers, and we were talking about it. They went on their devices, and immediately they were on sites where they could purchase these things if they wanted to. They just, are you 18 years old? They checked it off, and they went to the next screen. They could have ordered it just like that. Something that was pointed out, which I know a lot of people do, if you give a young person a gift card, a Visa card or a MasterCard, they have the ability to go and purchase anything they want on a website. So something to keep in mind when you're thinking of something to give. Not that I want to limit gift giving, but it's just something to be aware of, that it is easy for young people to access these devices on the internet. And the nicotine content that's in them, it's a pod that they put into these devices, and it's equal to 1 pack to 1.5 packs of cigarettes. We don't know how long the pod lasts. That's the one thing we don't know, but they're very high nicotine content in them. And prevention starts with a conversation, which we ask students who have talked to a parent or a guardian in the past 12 months about substance misuse, and that rate has gone up 5%. So at least parents are having conversations. Something we try to do is provide the tools to make those conversations easier. And it doesn't have to be a long, drawn-out conversation, but just a simple conversation here, there, at the dinner table, in the car going to soccer, to basketball. Just making sure students know what your views are on drug and alcohol use, giving them an escape plan if they're in a place where alcohol or drugs are. They can call you, they can text you, they can make up any story just so you'll go and get them out of that situation. Something that the coalition was started on was suicide prevention, so we've been tracking this for quite some time. The first category on the left-hand side is students who seriously considered suicide in the past 12 months. That's gone down 2% from the last time we collected. And students who felt sad or hopeless for 2 weeks or more and stopped their usual activities, that's gone up 1%. So it hasn't fluctuated too high or too low, but it's definitely something that we're aware of. We try to get information out into the community. We have the helpline. We've worked with the school to train staff. We're still continuing to do that. We have a grant from Exeter Hospital to do trainings with the school and the community. And we really focus on building a strong community to support our young people. That's definitely something that's shown results. Hopefully all of you are aware of, we are committed to a safe and drug-free Raymond campaign. We did it in all 3 schools. We did it community-wide. And obviously these numbers aren't directly attributed to that campaign, but they've gone up significantly. So students who feel like they matter to people in their community jumped from 35% to 63%, which is very encouraging. And students who feel like they matter to adults in the school jumped from 41% to 51%. So those are all going in the right direction. It's important that we talk about the impact of the heroin and opioid epidemic in the community. the rate, overdose death rate in 2016 was 9 people, and that dropped to 4 in 2017. 4 is still a lot for a small community of 10,000 people. And the impact of one person passing definitely has an impact on their family members, their loved ones. If they have children in the school, the residual effects is felt there. So trying to connect people with resources is something that we've tried to get that message out very strong. We've started some support groups in the town. We advertise the support line to get access to treatment and recovery services. And on Tuesday at the Raymond Baptist Church, we now have a full-time person there who somebody can go in and talk face-to-face with a person, who can help walk them through the process of getting into treatment or connect them with recovery support services. This a group of prevention people who have been trying to raise awareness to the alcohol and marijuana problem. Obviously, everybody has rallied around the opioid and prescription drug epidemic because it is so serious in our state. It's important that we remember that alcohol and marijuana are very important things that affect young people more so than the other things. They're more immediate access to those things. So to talk about alcohol prevention and marijuana prevention is very important. And our website is full of resources, so I just want to encourage people. That's what the coalition website is there for. We have all community resources, youth resources. If people have questions on drugs, any certain particular kind of drugs, information is on there. If we don't have the information, we have direct access links to take you to where that information can be found. We have a newsletter that we can keep the community connected on events and things that are happening. And we have a monthly networking meeting for adults and professionals. Anyone's welcome to attend those. They're on the second Thursday of the month, 9 to 10:30 at the Raymond Baptist Church. And we have amazing youth action groups at the middle school and high school. The kids are what the coalition is all about, and they guide us in a lot of the work that we do. Their voice is definitely involved. And this is a kid quote of what the coalition is all about. So everyone in our community will know where and who to go to for help and resources. That's what it means to them to be involved, and that's why they're a part of the coalition. And there's some pictures of them involved in the community. So happy to answer any questions if anybody has any.
Joe?
Well, it looks like that, marijuana is going to pass in a lot of states, especially around us. Who knows about New Hampshire yet?
We're going to do our best to help, and you all can do your best too if you write a letter or voice your opinion. There are several states that have turned down legalizing marijuana. The marijuana advocacy people have come in. I can tell you they target states. New Hampshire is one of the states that they're targeting to pass this. They have a business model that starts with therapeutic cannabis. It moves on to decriminalizing and then turns to legalizing. They've already gotten the first 2 steps, and now they're on to the 3rd step. But other states have been aware of that, and they've been very vocal. They don't want it in their state, and they have got it turned down. Massachusetts did pass it last year, and I was just at a conference. It was a very vocal and passionate woman who she found 4 words in their policy to turn it around, and she goes around to towns advocating with the town to put in town ordinances so shops can't open in their towns, because it sneaks in and people don't realize it's coming in or don't realize how important their voice is, that they can say something. And the implications, they're huge, especially for a school district. You've probably already had implications because of therapeutic cannabis. I know several schools have. It gets very tricky.
Do you have any plans if things do pass? How are you going to tackle the issue?
We're going to do our best to prevent that from happening first. So, no, that would be a conversation to have, though. It hopefully doesn't happen, Joe. I can give you some talking points to talk to some people. It would be hard for, I can tell you, the young people, for parents, just thinking about parents having conversations. All those numbers have gone up, and it's not even legal here in the state of New Hampshire. It just became decriminalized, and it was decriminalized after that survey was complete. So this survey took place last spring.
I really did like the individual you had during the breakfast this year. It had his whole findings basically financially. It had nothing to do whether it was right or wrong.
Right.
It was how much Because a lot of people think they're getting so much money, and the fact was that they're actually doling more money out than they're actually getting in
Exactly.
because of it. And I thought that was a very interesting point to look at.
Dr. Kevin Sabet, he's on our YouTube page. He did a presentation for us at our Prevention Summit in October. And he's a national speaker that we brought in, and he speaks. And the young people said the same thing. He didn't even tell us not to do it. He just told us all the reasons why it was a really bad idea to think about doing it, so. Any other
Anybody else?
questions?
Questions, comments? Thank you very much, Celeste, for
You're
the
very
work.
welcome. How
For
can I
tonight
get that?
and for all the work you do.
Oh, thank you. It's a combined effort, so thank all of you for being a part of the coalition, too. And how can I get that information to you?
Would you like me to write down my email?
Sure.
I don't think I have anything to write with, but
Look at that, instant help.
paper too.
Thank you.
Thank you.
All right.